Okay, hello and welcome. Members of the Chinese Medicine Practitioner Meetup Group, hosted by Kamwo. For those who don't know who I am, my name is Thomas Leung. I'm the organizer and your host for this afternoon or morning or evening, depending on, I guess, where you are. And that's the beauty of having on these online meetups. I just want to take a moment to welcome new members to our group, and I hope you enjoy what we have for you today. Hopefully, there'll be many more events and that you will join us in the future. The mission of our meetup group is to connect members to respected authorities on subject matters within our profession. So the events are always free, and our speaker suggestions come from you, the members. So if you have suggestions or speakers, please feel free to share with me. You can always email me, okay? This is our 129th event, but it's only our 7th online event. So and right now it's exclusively online. That's because of the ongoing pandemic. But at some point, we're going to resume, and hopefully we'll have hybrid events where we'll have live events, but also is that word telecast? It'll be streamed. That's the word. Stream online. Yeah, in the future. So, this talk is going to be about approximately an hour and a half. So, just so everyone knows you're ready. And here's some ground rules. Please mute your microphones and hold off any questions until the speaker has a break. And then you'll be. And then if you have anything urgent, you can always type it into the text box, and I will be monitoring the text box. There will always be breaks for questions, and of course, during the end, there will also be ample opportunities for you to ask your questions as well. So now it's my pleasure to introduce tonight's speaker. Many of you know Tom Bisio. But for those who are new to Tom, Tom is known internationally as a martial artist, practitioner of Chinese medicine, educator and author. He has studied Chinese medicine and martial arts extensively in mainland China and practiced acupuncture, Tuina, and herbal medicines since 1990. Tom Bisio has taught internal martial arts, Qigong, Taoist meditation, and life-nourishing longevity practices for more than 3 decades. He has written numerous books and articles on martial arts, Neigong, Taoist meditation, and Chinese medicine, created multiple online learning courses in Qigong, martial arts, and Chinese medicine, and is the founder of International Arts International. So,
Internal Arts
International. Without further ado, it's my pleasure to introduce my friend and Tom Bisio. All right, then I'll hand it over to you.
Okay, thanks, Tom. It's a pleasure to be here, and it was very nice of Tom to invite me to another meetup. I did one earlier live, so this is a new experience for me to do it on Zoom. As you were coming to the waiting room, I recognized some names and some names I didn't. So those of you I haven't met before, it's a pleasure to present something, and I hope you enjoy it. One of the things I've spent 30 plus years working with is the external application of herbs, which maybe it's better taught in schools now than when I was in school. When I was in school, we learned zero about external application of herbs, except unless you consider applying moxibustion, a kind of external herb application. So most of what I learned came out of martial arts training and a background in Dieda, injury medicine. And so over 30 years, I've had extensive study of externally applied herbs in conjunction with internal injury medicine.
I don't know the exact time, but you knew it was for.
One of the things in having that extensive study and practical use is seeing, like, I tried a lot of different formulas over the years, ones from teachers of mine, ones that I found in Chinese books. And so one of the things is figuring out which formulas are really useful, because you can't have 100 different external herb application formulas in the clinic, especially if you want to have them sort of ready to use. And so what I found was knowing a handful of really versatile formulas is much more useful if you can modify them different ways or they have different uses. And one of the things I've added to this talk, because I knew that some of you have probably heard me speak on this subject before, is some alternative uses of formulas that you may already use or that I've talked about before, that we often don't think about, but you find in Chinese books or the way they're used in China or ways I was taught to use them besides just injuries. And you want to make sure that you're, whatever, let's say you have 10 go-to formulas, you want to make sure that they'll work for a wide variety of people in a wide variety of situations in all the different stages of injury, and that you can therefore make choices or modifications. And there are a lot of different ways to modify things depending on how much you want to engage with the herbs themselves as opposed to pre-prepared things. So one of the keys and one of the place that I've found where people have trouble with external apps is understanding the stages of injury, which gives you the precision of choosing the right formula at the right time. And, I've taught the stages of injury before, so we're going to talk about them quickly. I'm going to give you like an in brief about it. But they sound very set, 1, 2, 3. But in fact, there's a judgment call. It's a continuum. And I think that's the difficulty, is something looks like it's in stage 1, but it's kind of segueing into stage 2. And how do you make those judgments? And if you make the wrong judgment, do you fix it later, right? I mean, usually you just don't get a good result. Sometimes you get a negative reaction that can then be changed by using the correct formula. One of the things about these Dieda formulas is they're fast acting, or they should be fast acting. They penetrate rapidly into the body. So when whatever group of formulas you're going to choose has to work quickly. And this was the idea in martial arts training. It has to work immediately to kill pain, reduce swelling within a short span of time, because people want to get back to the activity they're doing. And also when we talk about Zhenggu techniques, which I teach pretty regularly around the world, we're talking about putting things back in place, bones, ligaments, tendons. And sometimes we need an external application to reduce swelling rapidly or to break up blood stagnation so that we can actually do the Zhenggu technique. So things like things that are rapid acting that some of you know about are things like San San, which works very quickly, or some of the Diedaju formulas, the hit fall lines, where a minute or two after you rub them on, you have a change in the level of pain. Or something that maybe many of you are familiar with, like the Qingwan Hung burn liner, which you buy in Kamwo or any store in Chinatown for almost nothing. And my experience with it is it's remarkably fast acting. I mean, I have had second-degree burns in my palm, where I burned the electric stove onto my hand. So I had those nice rings there. And within 2 minutes of putting burn ointment on, the pain is gone. And within an hour, the redness starts to go away. And within 2 days, you got new skin coming in. So that's what I mean by rapid acting. It's not something you put on week after week and it just kind of dulls the pain. So we're going to talk about the formulas we're going to talk about are those kind of formulas. One of the interesting things I think about local treatments is you're targeting different levels of the body, just like with internal herbs, but the kind of delivery system is different because you're going through the skin and getting a penetration through the tissue rather than, and you are also to some degree using the herbs to target an interaction with an organ, but coming to the organ from the outside in rather than through the spleen and stomach having to break down the herbs that you ingest. And then within that, we have different delivery systems. So we have soaks, liniments, Gao, which you put on and leave on for 48, maybe 24 to 48 hours. And each of them has different qualities that make them more or less useful in certain situations. And then we can adjust the delivery system by what we add and subtract to it, or by using things like Bing Pian or Boho Bing, which are these very aromatic herbs that penetrate and carry the other herbs into the body. One of the things that I found super useful in clinical practice is, you know, you do your treatment and then sometimes you don't see the patient for 2 weeks. So if you can give them something like a soak or liniment that they do daily in that period, you're basically continuing an herbal treatment. And it may also be that you're giving them internal herbs too, but you're continuing that treatment over the 2-week period or 1-week period, or whatever it is that you're not seeing them. And that gets you quicker clinical results. There's also the idea that, well, an internal formula, we can use it we can add guide herbs or envoy herbs to bring something to a local area. Actually putting herbs on the local area, if it's my wrist or my ankle, is going to increase the effect because there's going to be an interaction from the outside in and the inside out. And so my experience is when you can get that working for you, you create a momentum, and that momentum builds and makes for a quicker recovery time. Now, I just wanted to say, because Tom said, talked about questions. So we don't have to, I'll take some breaks for questions at different points, but if you have a burning question related to something I say, you can flag Tom with the hand raised thing, and he'll let me know if we need to answer it right now. So I don't mind that. We don't have to wait till the end or something. So one thing about, if you're used to internal herbs, or if you haven't done much with herbs, in any case, it's a different way of thinking about how the herbs act a little bit. I mean, the herbs have the same properties, but sometimes we're using externally herbal properties that are kind of, if there's 5 things that the herb does, it's one of the ones that is down low on the totem pole for internal use. Or with things like Dahong, which is a purgative, right? We can, externally, it's not a purgative. And it has like a dozen uses in ways that we don't really use it in internal herbs, or it's peripheral in internal herbs. So I said we can combine internal formulas with these, and I said that already, but not just for injuries, but even things like prostatitis, right? We give people internal herbs, but the problem with internal herbs, much like when doctors give antibiotics for these situations, or maybe intestinal infection, is getting the herbs to actually target the area you want them to go to. And usually if you do like with the prostate or intestinal infection, you can do external herbal therapies. And I don't have an example in this talk I'm going to give, but there are many in China where you can have people do a retention enema, which then puts the herbal substance on the area directly that needs to be treated, in this case, the prostate or the large intestine. The other thing that's great about external herbs, and because I learned it in Kung Fu classes, and then went as part of Tuinan bone setting, where I didn't know much about internally applied herbs except pre-prepared things, is that you can treat small things when they're small so they don't become big things. This I Ching idea that, you know, change starts small and we only tend to notice it when it becomes big. But if you can catch it when it's small, it doesn't become big in a negative way necessarily. And I've seen that in martial arts. If sometimes you get in sports or martial arts, you get what seems like a minor injury at the time, and you don't treat it. You know, you finish doing your sport, you go home, you have some beers, you go to sleep, and the next day it's a little sore, but you're like, it'll get better. And then it turns out a week later that it actually wasn't such a small thing, or it's a small thing that builds as stasis backs up behind the injury and becomes something big. So what I learned early on is if you treat it when it seems like, oh, it's no big deal, it often, you'll never know if it was a big deal. You think like, oh, see, I was right, it wasn't a big deal, but maybe it was because you put the herbs on it. And so it encourages you to think that way about small things happen or small sprain. If you do something right away with a liniment or poultice, often the next day it seems like nothing happened. And that's been a real kind of thing I've noticed in 30 years of treatment, that the people who do that recover quicker. The people who don't and they wait until it, oh wow, now my ankle really is a chronic problem, then it's a chronic problem and it's much harder to treat. So external herbs can be great for that because it doesn't require writing a prescription and going to Chinatown and getting the herbs or having them shipped to you. If you have some of these things at home, a small 10 or 12 different things, you're prepared for most situations, particularly when it comes to external injury. Any questions so far?
Yeah, feel free to raise your hand.
Yeah.
Okay. Yes.
Okay, so I'm going to just quickly, I've given a lot of lectures on the stages of injury, so I don't want this to be a repeat of a meetup I did before in the Kamwo store. So I'm just going to go through them kind of quickly. Stage one, we could say it's like things are red, hot, swollen, right? I sprain my ankle, it swells up, the qi and blood block there, so there's heat because of the wei qi blocking and the blood accumulation. And we get, and often that swelling is that kind of hard, expansive swelling. We get discoloration, maybe black and blue, maybe not initially, but maybe the next day. And usually initially, at least, some kind of acute pain. I mean, part of the idea of swelling and bringing blood and qi to the area, which your body does automatically when you're injured, is that it kind of splints the area and in effect, to some degree, reduces the pain so you won't walk, but the swelling splints things so you won't walk on it if it's a ankle sprain or a knee. You blew your knee out or you sprain your wrist, then you won't use it because of these phenomena. In these cases, we can generally say, and this is a generalization, that external formulas are either neutral in temperature, which is like a lot of the jiedaju, the hit-fall liniments. They have a mixture of cold and warming herbs that penetrate obstruction. So if you put all the temperatures together, it's not really too hot or too cold, but we have things that are creating movement. So a slightly yang, but not super warm. Or if we see that red hot swollen thing with blood stasis, the formulas tend to be relatively cooling. So San Huang San, which I kind of coined as herbal ice, which is not really the same thing, is an example of that. And when we talk about internal formulas in this situation, we're talking about things like Diadawan, trauma pills, hit-fall pills, which pretty much are focused on breaking blood stasis, killing pain, and trying to restore the free flow of blood and qi. So that's usually what we're talking about in the first stage of injury. It's pretty straightforward. If you happen to be there when the injury happens, it's very obvious. It's a little less obvious if you see them as they're progressing along the later stages of stage one. It might look sort of like a stage 2 thing. And we'll talk about that, or if there's questions about it, we can talk about it. In stage 2, we tend to see less acute pain, right? There might still be pain. There might still be swelling, but often it's reduced swelling, or in a later stage 2, when you're a couple weeks out from the injury, or maybe 10 days out, you might see, like, an ankle's a really good example, because you'll get these little pockets of swelling around the malleolus, where in these small kind of cave-like areas around the bone, some blood, qi, and fluids is just getting stuck. We'll also sometimes see that in reaction to, particularly if the ligaments and tendons get stretched, the body reacts by contracting them and we'll see like a contraction or stiffness, where in the case of like an ankle, it won't flex all the way, it won't bend, even though the swelling's down, or wrist, there's going to be reduced mobility. Same elbow, it doesn't really matter where. Neck, where it's harder to use external applications, we'll see the same thing, right? That people they can move their head, it doesn't hurt as much, but they have reduced range of motion. So we start to think now about more warming liniments, just slightly more warming, and things that have properties of removing fluids to get rid of this residual swelling. So we'll sometimes see things that actually work with the spleen, or with reducing the accumulation of water in the area. Herbal soaks become really useful at this stage because they're pretty hot. You're cooking the herbs, and then you're either sticking your ankle in there, or if it's your shoulder, your back, you're wringing it, you're putting towels in it, or like pieces of flannel, soaking it in the soak, and then applying it locally. And every time it cools down, you're switching up to another hot towel. So this is adding like a wet heat. And why? Because the wet will penetrate into the dampness and start to move it. It'll penetrate into those pockets of swelling and start to move it. The wet heat will also, especially if we're using soaks that have properties of things like togutsao or songjae, which kind of break stiffness and allow the bending and extending of the joints and the tissues, allow the tissues to lengthen. We'll see those often in soaks because we want to address, particularly with the soak, pain, the stiffness at this point, and these pockets of swelling. In terms of internal formulas, they can be very similar to the first stage, restoring the free flow, moving qi and blood, breaking stasis. But we often at this point also see some addition of tonic herbs, either to nourish the body itself as a whole, so that it can, it just has the wherewithal to heal the tissues, or very specifically, things that target the tendons and ligaments or the joints themselves. So a good example is like in a lot of formulas for injury, you'll see one or two herbs like Juan or Goosewebu that are kind of tonic herbs, but they have this thing of getting out wind, cold, and damp, and strengthening sinews and bones. So already this idea that, oh, maybe they have a fracture, but in this second stage, we're not just going to move the stasis where the swelling was around the bone break. We're going to also start to add some herbs that tonify and help the body to actually build bone, or help it to heal the damaged sinews. Okay, and then we get to third stage. So third stage can be the gamut. Maybe there's no swelling and inflammation, but there's stiffness, or still restricted motion, or it hurts when it's cold out, or when there's a weather change. More like moving towards a obstruction syndrome, where pathogens, in the case of like cold and damp, have mixed with the stasis, or the stasis has created a situation where there's a deficiency of our defensive qi, so that pathogens can now enter, because presumably it's at a stage 3, we're talking about a month after the injury, or 6 weeks. So there's been this reduction in the wei qi for a period of time in the local area, and now that allows pathogens to come in, or we could actually say it is a pathogen, that the area gets less circulation, so it feels cold, or it feels like heavy. There are often still accumulations of qi and blood fluids, but they're smaller and they may be harder to detect. If there was tearing of the sinews and the muscles, there could be instability in the joint in this chronic stage, which needs to be addressed both internally and externally with herbs. And I already said that the qi flow and circulation is impaired, so we have cold penetrating. Cold is a big one, but it could also be dampness. And the last is there may be adhesions, right? Because of this stasis, we know kind of that fluids and blood that gets stuck in an area, especially blood, if you've ever seen blood that's dried up, right? It becomes very hard and sticky. And these fluids will also become sticky. And we can even say they get cooked by the body's heat and become almost like phlegm. And these things can create adhesions where the tissues stick together. Also, if the tissues have been twisted, we might see tissues that should be laying nicely like this, and they're now stuck together like this, and those adhesions need to be broken up. So the external formulas are going to be much more warming at this point. We still might have a couple of cooling herbs in there, but we're going to see a general trend towards warming to even hot formulas that move yang, drive out any wind, cold, and damp, and also reduce pain by creating this movement and relaxing stiffness and spasm. So two herbs that we see a lot are some of the aconites, not so much Fuzhe, but Chuanwu and Saowu, these other aconites that actually penetrate more into the channels and collaterals themselves. And they're very, very warm and even hot. But one of the things, because of that heat and because they create movement, they actually kill pain in a big way and push pathogens out of the body. We may also see that some soaks are engineered to disperse bony calcifications, right? Because as fluid and blood gather in the area and they harden, we may also get like the bone gets irritated by these deposits on it. And so there'll be bony calcifications that need to be broken up before they really become hard. With internal herbs, I kind of already said it in stage 2, there's going to be now more of a focus on tonifying, strengthening the body, strengthening the yang, so the body can repair the damaged tissue, but we're still going to have herbs to break up this residual stasis, right? So in some cases, a good example is like in an external formula, you'll see there'll be more tonifying herbs or strengthening herbs, but it'll still be largely a moving formula. Whereas the internal formula will be the opposite. It'll be much more tonifying with just some moving herbs. And that creates a really nice complement internally and externally. Any questions on that? So I just put this up in The Tooth from the Tiger's Mouth, and also done some articles on the Kamwo site and on my site where I really detail the stages of injury and give it a lot of examples. So you can check it out in that book if you have it, or you can look on the Kamwo site where I did something on the stages of injury.
We do actually have a question for you.
Yeah, good.
Pamela, do you want to unmute and ask your question?
Hi there.
Hi.
I'm so happy. I have 2 of your books. Looking
okay.
at the third one. I want to ask about kind of old or antique injuries from, say, 20 years ago, twisting your ankle a couple of times, still having the pockets,
Right.
Around the malleolus. Is that something that is super hard to treat, or is it treatable with a combination of internal and external herbs?
It is treatable with a combination. You may also need to do things like bleeding on the channel, or even like 7-star hammer. And often with an old injury like that, you'll hammer along the collateral and you won't get any blood to come out at first. And then gradually, as the blood starts to move, you'll get this flow of dark, stagnant blood coming up. But this is sometimes a case where we use these stronger internal formulas because what you're describing to some degree is dead blood, which to me is, as the way I learned it in martial arts, is different than just stagnant blood, right? It's blood that actually will never really go back into circulation, and it's preventing the formation of new blood. Or new blood getting to that area. So in those cases, you need things like some of the internal formulas. They'll use combinations like shongdi and shudi with that re-moisten the blood, and then in conjunction with things that move the blood. So often you need some blood moisteners to start to soften up the blood. And it's also a place where soaks are really useful because they'll start to break up those deposits. Even though we often say soaks are more stage 2, they go into stage 3. And then you would just have to decide, is it more like it needs warming soak with a lot of warming herbs that drive qi and blood through it? Or does it also need like a lot of blood moving?
Oh,
I find though that combination, especially if you're also doing external work on it, like tuina, like cupping, like guasa, for those really old injuries, you kind of need all those things. I can
And
give you
for-
one example. Oh, sorry, go ahead.
for patients who have, they can tell when it's going to rain or
So now
have,
we're talking about B syndrome then. And that leads to, so doesn't change much the external formulas because the soaks would still be useful, or like a stage 3 liniment, like we have one with Kamwo, but there are many like this, some where I have it in front of me here. We call tigers invigorate the collateral ligament, right? So this is for a stage 3 thing, and it's particularly for this B syndrome where there's herbs in there that help get out wind, damp, and cold. But then you're talking about B syndrome type formulas like a Dupoji or I don't know, there's a whole category of them, one's for cold, one's for damp, and you can modify them. Or Juan Bitang is a very good example because the whole formula is just meant to be modified. It's cold, you take out these herbs, you add cold herbs that warm. Oh, there's damp, you take out these herbs, you add herbs that warm and move dampness. Oh, there's more blood stasis. Okay, take out some of the dampness and put in blood stasis. So I find formulas like that are really, really valuable in those situations. And then if there's this dead blood situation, you often add the insect medicinals like Meng Chong and Tu Bia Chong and things like that. That actually the whole idea of the insect medicinals that, right, insects go into little cave-like areas and they move stuff around, and that's what they do in your body. So they break up these deposits, these small deposits of blood. And so often you see those things added for these extreme B syndrome cases. But you have to be careful because if the person's also deficient, you can't put too many of those in there. I actually did a course on B syndrome with Healthy Seminars. We go into all the different formulas and all the ways you modify them. That's an online course. It's actually a pretty cheap way to get all that information in one package. So did I answer the question or not really? Was that clear?
you did, and thank you so much.
Oh, you're welcome. Thanks for the question. It's a good one.
Okay, we have Barry next. He has a question. Barry, you want to unmute yourself?
Hey, Tom.
Hey, Barry.
How you doing, man?
Finally, we see each other.
Yeah, I know. So my question is this, depending on the type of injury, and I'll A/B this, like a strike to the head where there's not a lot of soft tissue versus a kick to the thigh where there's a lot of soft tissue, would you like modify these stages based on the location of the injury?
Well, okay, a blow to the head because it penetrates the brain, I have to modify it right away, right? Often, if we're not sure, in like a martial arts setting or first aid setting, something like Yunnan Bio is your safest bet because it breaks the local stasis, but it also prevents bleeding. So when I used to referee stick fighting tournaments and people got concussed in the head with a stick, and I know since you do that art, it's interesting, hopefully to others too. But the same if you take a fall and crack your head, that's really the only thing you can give somebody before they go to the hospital and get cleared, right? That's the only safe thing you can give them. If they're cleared and you let a couple of days pass and then they have the blood stasis in the head, then there are very specific formulas for that. I can't remember the Chinese, but it's like there's one formula for blood stasis in the head, which actually traditionally has musk in it because it opens the orifices and right, because the head is actually a hard place to get blood stasis out of if it's like sitting under the skull. So you can not use musk, and what I've seen in Chinese books now, they'll advocate using like 15 to 20 grams of Bijir instead of the musk in a formula like that to just open up the head. And you could also think of other things that would open the orifices that are safe. Whereas in the leg, I don't have to worry about like bleed on the brain, right? I can go right in with a HIT pill, which I would not give to the guy who has a head injury, which is gonna, right? The traditional HIT pill has Ma Huang in it. So Ma Huang's function, and then it has a bunch of blood moving herbs, including the tubiachang, the beetles that break blood clots up. So the function of Ma Huang there, we used to like to say, it's a little bit like taking a hose and opening everything up by pushing the qi and blood and fluids through it, right? But you could not, obviously you couldn't give that to the guy who got hit in the head, right? That would be the big difference to me in the first stage. In the second stage, then it's going to be more this question of, well, what will actually move stuff in the head? So Juan Song is one of the herbs that really moves blood stasis in the head. So we have to figure out those herbs. Whereas in the leg, I could do something more generic because especially if it's a big hematoma on the thigh, I mean, I can do external poultices. I can do, after the HIT pill, I could give them different blood moving herbs and just add guide herbs to the legs, like Nushi, Mugua, things like that. Even Wailing Shan, right, to just get the channels and collaterals to open. I'm going to talk about San Wang San, but you made me think of something I had forgotten to actually put in my notes. One of the ways I learned to use San Wang San, which is one of the first formulas we're going to talk about, was in martial arts when people get hit in the biceps and all the blood vessels in the muscle explode, and the whole thing turns black and swells up. So actually we use San Huang San with egg whites, which is kind of messy to wrap, but within a day, it looks totally different. It'll be like the swelling will have gone down significantly. There'll start to be movement through the arm. And it's not just in martial arts. I saw a person who'd been kicked by a horse in the leg, same thing. Their whole thigh, it was just double the size and black. Right, and you put the San Huang San on for a day or two and mix with egg whites, and pretty much within 24 hours, it looks like an older bruise already. And I think those things are super important to treat right away because the doctors will tell you, oh, the blood will reabsorb. But those are the people like 20 years later, which goes back to the previous question, who they have the dead blood in their leg, right? There's like numbness, lack of sensitivity in the area compared to the other side. Maybe it gets cold, and it'll sometimes have like a dusky color under the skin. It'll look like the other leg, but you'll just see there's a faint duskiness, and that's that dead blood, which if you've done the San Huang San day one, you won't have that 20 years later. And 20 years later, that's really hard to treat. We got to give them all these things with bugs in it, and soaks and acupuncture and bleeding the channel. And I've seen a few people like that, and it's not a quick treatment at that point. Whereas if you do it correctly, with what you're talking about, it's pretty quick. And with the head injury, what we worry about if we don't move the stasis is that they have a couple more bumps to the head. Doesn't have to be getting hit. It could just be like banging your head. And then they start to get that syndrome where you get concussions if you shake your head quickly, or even just a light bump like that, and you get concussion symptoms. So you really, if you give them the correct formula for the head injury right away, you prevent all that coming down the line.
Thanks, man.
You're welcome.
Sorry, Tom, can you unmute yourself? I
You
think
muted yourself, Tom.
yeah, sorry. Tom, can you hear me?
Okay.
Okay, good.
Okay. So, we have, this is where there's two options with herbs, and I'm going to go into a bunch of like where you're using things that are prepared, like in the Tooth from the Tiger's Mouth product line, which Kamwo makes, and things where you don't actually want the herbs pre-prepared because you want to mess with them. So one example of that is the example I gave with Barry, where here Kamwo actually makes really well. The liniments, the soaks, makes them super easy to use. And particularly the Gao, because anybody who's done it in their clinic from the powder, it's messy, it takes time. The quality of the Gao are really great. And I pretty much don't buy the powder much anymore, except for certain formulas, which I'll talk about. Because you just slap it out of these containers, stick it on there, cover it, and it's good to go. It doesn't tend to leak the way it does when you mix it with other mediums in a sloppy manner, which is the way you pretty much end up doing it in the clinic. Whereas down in the basement of Kamwo, I've seen they have these machines that stir them endlessly until everything is very smooth. And then when it hardens quite nicely. And it's just the heat of your hand touching it starts to melt it back to the perfect consistency to put it on injury so it doesn't leak. So, but the disadvantage of that is you can't modify it. And so in the case of like the example of the bicep with the egg whites, then we can't use the egg whites because most of these are made with beeswax and sesame oil, which is a traditional way to do it. And the modification of the egg whites has an effect on guiding the formula into the muscle tissue. So there is an advantage in certain formulas to having other ways of doing it. And so in these couple of formulas I'm going to talk about, I often have both the powder on hand and the pre-made Gao. All right, in terms of liniments, you have to pre-make them. So either you get gallons of alcohol and put herbs in it and shake it up every once in a while and hide them in your closet out of the light, or you pre-buy them and then you bottle them for patients and for yourself, taking out small amounts from the big bottle after a year or so of them sitting there, or you buy it pre-made, or you have patients get it at the store. So I've always made my own, but I also in recent years, more and more, just people call me and they have an injury. I'm not going to be able to ship them the herbs. I don't do that. They're not going to come to my house to get, well, I pull my bottle out of the closet. So I send them to Kamwo. They can buy it on Kamwo. It can be shipped to them. They don't even have to live in New York. So there's advantages to both ways. And I do have to thank Tom for asking me to curate that line because I buy it all the time myself. Okay, so we're going to talk about Gao poultices, right? Now, Gao actually refers to what we call a poultice, where we have an herbal matter mixed with some medium that makes it wet, and we slap it on the area and we tape it on or wrap it up with an ace bandage. But it also refers to the kind of plasters you buy that have a sticky adhesive, and you put them on the local area, which, so my one issue I've had in the last 5 years, a lot of the Gao that we used to use that came from China either don't get imported, or the ones that get imported actually don't work as well as they used to work, with some few exceptions. So I'm not really going to talk about the Chinese Gao and the ones that you buy pre-made or shipped from China. So I've been relying more on the Gaos that Kamwo makes or that I make myself, because we know what the ingredients are and we know they work, whereas often what's on the label now is not what's in it. And even some of my old standbys like the 701 plaster, and I have to say even Goupy plaster, which is supposed to actually have herbs in it, they don't seem as strong as they were before. So one I'm going to hold up my little Band-Aid box. One of the great things is I would always use these kind of gal from the sticky gal that you would buy pre-made, because like you have a shoulder thing or not so much the neck, but like a back problem, and you couldn't really wrap it well with the kind of ointment type gal. But you know, Band-Aids, there's now a lot of Band-Aids, these nice big Band-Aids that adhere really well. And I've just been more and more sticking the gal in the center of it and then really smoothing it down and taping the edges, and it's better in a lot of cases than those stick-on gal. On the low back, I'll admit this doesn't work as well, but on a lot of other parts of the body, you can use this method. One of the things, one of the problems with gal is diagnosing, right? Like, when do we use the first stage one, San Huang San, as opposed to like Jin Huang Gao? These are the two I'm going to talk about a little bit, because they seem kind of similar in a lot of ways, but what makes them different? So knowing when to use what Gao, and this goes back to the stages of injury a little bit, and the warming and cooling herbs. One thing I have on the PowerPoint here, there's no such thing as inflammation in Chinese medicine. So although we have these cooling herbs that are a bit antibiotic-like in some of their effects internally, they are not for inflammation. We don't treat that in Chinese medicine. That doesn't exist in Chinese medicine. What exists is swelling, heat, pain, and redness, which may be inflammation or it may not be. And in fact, there are some articles out there, which I talk about in one of the classes, that actually inflammation is more often caused by cold than it is by heat. And it's a super interesting idea, because when you read the guy's article, he, and I suppose I could send it to Tom if people are interested. He actually is saying that cold kind of acts like a pathogen, the way we think about it in Chinese medicine. So I encourage you not to think that use these gals because you see that there's inflammation. You think that's the reason for the cooling herbs. It's because it's red and hot. That's why we use the cooling herbs. Because I find the inflammation things gets people in trouble, and it mixes ideas from Western medicine that are not really part of Chinese medicine, or they don't mean the same thing that we mean. So here's our first Gao, San Huang San, which is pretty much equal amounts of these 6 herbs. Now the traditional San Huang San, or the original San Huang San, oh, I actually left one herb out. That was brilliant. The herb missing, the mystery herb is Da Huang. So Huangqin, Huangbai, and Da Huang all have the word Huang in them, yellow. So this was the original 3 yellow powder for external use. There's a different 3 yellows for internal. And then in martial arts traditions, they add Pugong Ying, which by itself is sometimes mixed with egg whites to reduce swelling, Honghua and Zhizi. So this is the one that Kamwo makes is this San Huang San. This is the one I learned in martial arts, the one I used with the egg whites and that on the leg. The guy who was kicked by a horse and the martial artist who was hit in the bicep. I've kind of coined the term herbal ice just as a way, so we use that on the Kamwo product, as a way to get people away from thinking it's red and hot and swollen, so we should put ice on it, because we can put this on it. And if you have the pre-made Gao, then if you're a sports person or martial arts person, even if you don't have your own, maybe you're on a sports field or maybe you teach in somebody else's space, you can bring a first aid kit that has that in it. And so it makes it simple. So as I've said, we use San Huang San for that first stage of injury. Things are red, hot, swollen, and painful. And, you know, it's interesting because sometimes when you see, and let's use the example of sprained ankle because they can really blow up. When it's blown up like that, it's hard to needle it adequately, right? You can needle it to get dispersed stasis, but you can't get into the bony prominences, partly because you can't see them. Or a knee also can be like that. Sometimes you can really get inside the joint with a needle, and sometimes you cannot. So, and we certainly can't mobilize the joint in any way. Like if you do Jungu or Tuina techniques, you're kind of limited as to the mobilization techniques because the body's splinting the injury with the swelling. So typically in my clinic, what we used to do was you'd give it, somebody would come in like that, you'd do acupuncture, bleed the area a little bit, and then you'd put a poultice like this on and say, come back tomorrow. Because by then the swelling between the bleeding and maybe the acupuncture and this poultice, the ankle would almost be down to normal, or at least half the swelling would be gone. And then you would be able to do things at a deeper level because you could actually see the tissues you want to work with more clearly. And you could do some gentle mobilization or maybe a more direct mobilization. So that's the kind of dead die use of Sun Hong San. And then the correlative use was this situation where Sun Hong San has a property, particularly when mixed with egg whites, where it goes to the muscle levels of the body. So if there is some situation where they have a chronic kind of, I've seen it used occasionally for chronic things with like a back where it manifests as a hot swelling, where you could then spread this over the area of the back to reduce that. So you wouldn't do it regularly, but you might do it 1 or 2 times to bring down that kind of irritation and that's creating the heat and swelling. Or in a situation of like a muscle pull, right, would be the other place you could do it. So someone really pulls a muscle and it's not really swollen, but they have that sharp pain. This might be a good treatment with egg whites, like a hamstring muscle, especially if it was just the first or second day after it happened, because of the penetration into the muscle layer. And Da Huang, when we use it externally, it doesn't obviously act as a purgative. We're using it because it's a blood moving herb that's got a cooling quality, and it's very good for that. And Jerdza and Puganging also have a bit of that quality. It's the only warming thing in this formula is Honghua, which also works in that surface level between the muscles and the flesh and in the muscle layer. So it's a perfect, right? And if we take it internally, it also works. It works in those layers, but it also works more in the upper part of the body. But here, it's going to work where you apply it. So it's very useful in this situation. But I want to talk about, there's a whole other use of San Huang San. And here you can't use the way it's pre-made with sesame oil and beeswax. Things where there are infections, so local inflammation with like pussy swelling or pus exuding, erythema that's hot, different kinds of carbuncles and furuncles, where they might also have fever and chills, or any kind of, I don't mean blisters here in this list, like you got a blister because you were, raking the yard of leaves or something. I mean more like the skin is blistering due to some inflammation. So in this case, if it's an open lesion with pus leaking out of it, you actually just want to use the powder, right? Because we don't add wet to wet. So our medium is just we don't mix it with anything. We just sprinkle it into the area and bandage it. If it's a hard, painful boil or these carbuncles and ferrules where they swell up out of the skin and they have a kind of a head to them, we often mix it with honey because it has an astringent effect. And we put it on there, and what it does is it starts to pull the toxic core out of the boil, the carbuncle, the furuncle, so that it can heal. The problem with the Western approach, which is antibiotics, is, and I've seen this multiple times, is people get a boil They take the antibiotics, it goes away, and a month later, a bigger boil pops out somewhere else, or multiple boils. They take the antibiotics, it goes away, and the cycle continues because the kind of rogue heat and the toxic element that's in the boil is pressed down by the cold nature. If we look at antibiotics as herb, it kind of presses the heat down, so the swelling goes down, they feel better, but actually the heat then just tries to vent out somewhere else. So the idea is to actually let the heat come out by using a formula like this, but now we're using it with a drawing element, some kind of medium like honey that will create a drawing effect. I suppose you could also use, honey has a antibiotic effect, which is why I think it's used here, because you can use honey, and I mean like pure honey, not the stuff you buy in the local supermarket, you know, not Golden Bee honey or whatever the brand is, but real honey from someone who raises bees. Like they actually use it a lot. I've seen people in France use it on burns all the time. I'm sure people here have seen that. So it's got that other element to it, but you could probably use it with some kind of clay that had a drawing effect as well. And then you'd have to have some liquid medium to make it into a mud kind of situation. Okay, so Sanwang-san, generally a first stage injury thing. We don't use it in the later stages because it's so cooling. Right, as we get to second and third stage, we don't tend to use Sanwang-san. We tend to use things like Jin Huang Gao or a formula like a Dieda formula that has a mix of cooling and warming herbs. But it does have this other use for infected wounds or heat that's trying to vent from the body. And it's very, very useful for that in a powder form. Are there any questions on Sanwang-san? Okay.
There was a question
Oh,
from,
okay.
yeah.
What was the question?
Who had a question? I'm sorry, I was looking. So, okay, I don't remember who it was, but whoever it was that sent me a message, you can just unmute yourself and ask your question. Okay, maybe they got shy. Let me see if I look through. Okay, I don't know, Tom, sorry.
All right, well, whoever it was, if you know, if it comes, if you can interrupt me on this next one if you have the question on
Okay,
someone.
just raise your hand and then we can.
Yeah, do the hand raise.
Okay, thank you.
So Jin Huang Gao, we also make as a pre-made, right? In Kamwo, we call it extra strength golden ointment because we added some Tibetan Honghua to make it a little stronger for an injury situation. But the traditional formula is here without the Honghua. So in Jin Huang Gao, this is for a second stage injury because we start to have things like Baizhi, like Zhanghuang, Sangju, Tiananxing, sorry, I think I spelled it wrong, which have which are kind of warming, right? Hopo also. But we still have two of our three yellows in there, Da Huang and Huang Bai. And Tianhua Fun is a little bit cooling too. So we also have things like Baizhi, Chenpi, Sangju, which actually move fluids, right? When we take them internally. So what's interesting here is this combination of warming and cooling, but also an emphasis on moving some fluids. And Baizhi and Tiananxing break up phlegm, right? So, so this idea that fluids that are stuck are under the heat of the body over time, they're going to go towards being cooked into a thicker substance that we call phlegm, but also that we have these pockets of swelling. So we want to prevent that before it happens. So we have these things to move fluids and break up phlegm before it even occurs. We have Zhanghuang and Da Huang, which are both blood moving herbs. And then we have things like Chenpi and Baizhi, Songju, right? That and Tianhua Fun, which is cooling, also, but also creates some movement of the fluid. So by combination of these warming and cooling and moving fluids, we're really looking at that situation of there's these residual pockets. Now, I'm not talking about that other question, the first question, which was like 20 years later, because this formula is not going to move those so well, right? We actually need more things that open the channels and drive it. I'm talking about a week after an injury, the classic ankle sprain, and even maybe you gave them the Sanhuang San, it brought the swelling down, you did acupuncture, but 10 days later, they still have that stiffness. This is the, I'm sorry, not the stiffness so much as the pockets of swelling, right? Then we might switch to this. Or more reasonably, they didn't come to you when the ankle was first sprained. They came to you 7 days or 10 days later because they just thought it would get better with some ice, which has now put cold into the area and actually help fluids congeal more. So now we might want to think about Jinhuang Gao because of those warming herbs and those phlegm dispersing herbs. It's going to break up the pockets of swelling, but there's still an element of heat in there in this idea. So we want to see when we use this formula that there's a little bit of heat, but there's this other situation of the pockets of swelling, right? The residual swelling. If there's no heat, then you could go to something that's a little more like the, I didn't put that in here, but a little bit more like the formula that Kamwo makes, which is Dia Da Gao second stage, because that's basically a slightly warming formula that, but still has a bunch of Da Huang in it to keep it from being too warm and to break blood stasis. So those are my two differentiations really in that situation. Either the Jinhuang Gao, because it's more about the swelling and the fluids and the phlegm, and there's some warmth, or there's no warmth and it's all about like blood stasis that's still dark, and we see those bruising, the kind of bruising, but with swelling. So I'm going to think maybe less about the pockets of swelling, maybe more about the blood stasis. So then I'll go to the situation of using a moving formula that has some Da Huang in it. So I think in that formula is like 30% Da Huang or 20% Da Huang, and the rest is a mix of blood moving herbs that are mostly warming. Another thing you can do that a friend of mine told me about is you can, let's say it's blood stasis. So this is now you have powdered Da Huang. So we're breaking out of the pre-made thing a little bit. I have powdered Da Huang, but I want to put a blood moving poultice on something, but I'm still worried that there's some heat. So what you can do is lay down a layer of the powdered Da Huang on the bottom and then put the other poultice on top. And that creates a situation where you've added a big cooling element locally, and the warming herbs have to penetrate through the Da Huang, which means you're dealing with both the heat and the residual heat and the stasis. So that's like a clever way of using Da Huang to take a second stage formula that's maybe too warming and make it appropriate. And I think those are the kind of things of what I was talking about early when I introduced the kind of thrust of this class, is this not having more formulas, but having more ways to use what you already know so that you have a flexibility, right? Because all of us in a clinic or even an emergency kit, we could have some powdered Da Huang. We could have maybe the Jinhuang, the Sanhuang San in a powder and in a small amount, and we could also have it in the pre-made, or we could do that with Jinhuang Gao. One of the things about Jinhuang Gao is again.
All right, Tom, I have a question from
Question.
before we get too far, from someone asking if is it good for burns on hands, like no pain, 3rd degree, but skin intact?
I actually think yes, you could do it, but Qingguanhong burn ointment is just like, it's amazing, and it does seem to still not be adulterated in the last few years, like some of the other things we've gotten from China. I've used that on 3rd-degree burns, small ones. I've had at least twice pretty big 2nd-degree burns on myself. We used it in the clinic on a steam burn to the face on a woman, and you know, like it looked like it was going to scar, and then you see like with the I mean, it's kind of nasty because you have to put that stuff on your face, and it actually looks like you have leprosy or something. But it kills the pain very quickly, and then you see the pink skin coming up pretty quickly right? Because once you have a burn at that level, the skin that was burned, even if it's not broken, it's eventually going to crack open. And what's nice with these with this Qingguan Hong burn ointment is you see the pink skin coming up underneath, and people often, mostly I've seen heal without scarring. But you could use this for a burn because it has both properties, right, of moving the fluid that's there and also preventing blood stasis and getting rid of the heat. So you could also mix it with egg whites for that purpose, or you could just mix it with water or something like, because you want it to be extra cooling, maybe green tea. You make green tea in a cup and use the water, so that makes it a little more cooling. Or juhua, chrysanthemum tea could also be, because if it's cooling nature and it goes to the skin and skin level of the body. But one of the things you'll see with Jinhuang Gao and is we can use it for early stage boils or these summer boils that come out in the damp summer, where there's swelling, itching, burning, and pain. And it has like a short root, meaning like it doesn't swell way up, but you get this short toxic core in there that goes down. Abscesses, contact dermatitis. I have used it in a powder form. You can for the flesh-eating, one of the varieties of flesh-eating bacteria where people have a big hole in their skin with pus coming out. And I'll talk more about a case like that later. Contact dermatitis, herpes zoster, even if it's really hot and inflamed, it'll kill the pain. It's a little messy if it's, of course, on your rib instead of somewhere else. Various cysts, bacterial skin infections like erysipelas, I don't know how to pronounce that, which is in the upper dermis but extends into the cutaneous lymphatics. So it's kind of a dangerous situation, which can go to a much deeper infection. This is a really good way to treat it with an external liniment. Again, you need the powder. And in this case, if it's not oozing pus, then you're going to need a medium to put it into. Often, again, chrysanthemum tea or green tea is a good medium. In the case of the boils, of course, you want to do something that draws. Toxic sores that are deep in the body, so maybe there's a slight opening in the skin, but the sore actually penetrates down. Again, something that will draw would be mixed with Jinhuang Gao for that. And I've got a whole other page of applications here. All the things we use San Huang San for, because again, we have, so the furunculosis, the furuncles, the carbuncles, lymphangitis, lymphnoiditis, right? These can it can be applied externally, or you can, if it's actually in the throat, you can actually sort of blow powder into the back of the throat. It can be used as a poultice for acute mastitis if there's heat and swelling, and chronic ulcerations of the skin. So that's where I've mainly used it, and I've used it with the carbuncle boil situation. But these are indications, actually in China, in a lot of the Chinese books, they don't even talk about using for trauma. In Chinese external application books, they talk about these things much more than the trauma. So it's the martial arts lineages that have adapted it for trauma. Because of its effect on things like this, we can apply it in another idea of swelling and heat. And I think it's really interesting because, again, I don't have to know a bunch of other formulas to use Jin Huang Gao in all these unique ways that, I mean, there's many, many patients that have one of these kind of problems that come in, besides just the people that sprain an ankle or you know, tear a ligament in their knee or something, their knee blows up. And again, like the whole point is the sooner we either draw out the toxicore or the sooner we move that stasis, the quicker they will recover and go back to normal functioning. The longer these situations stay in play, in the cases of some of these situations with kind of infectious situation, they can go deeper the longer they seem to be at the skin level. They're actually rooting deeper in the body, in the same way that stasis that remains unresolved slowly over time keeps creating a blockage that can build or become something more. And so the idea is the quicker we disperse it using local treatment in conjunction perhaps with certainly acupuncture or internal herbs, the more chance that there will be no recurrence and that they'll go back to normal functioning. So again, Jin Huang Gao might be something you want to have. Not, I mean, these are not so much first aid situations, right? But you might want to have in your clinic powdered as well as pre-made, just so you have both options. I mean, I know there are people, we make I believe Kamwo makes it with the traditional way, which is sesame oil and beeswax, and there are people allergic to sesame. So you may, in those cases, need to be able to use a different medium by mixing it. Okay, and generally when we talk about things like San Huang San or Jin Huang Gao, mixing it with a medium, we're talking about something liquid. So you're mixing the powder until it becomes thick like a paste, right? It's still wet, but it's not runny and it's not too dry, right? And we want to pack it on, or if we're using the pre-made, we want to put it on and then put a bandage over it that breathes, so that it gently is pressed into the skin and there's maximum contact with the skin, because then there'll be penetration into the body.
Tom,
Yes.
we have a couple of questions, but
Okay.
for the interest of time, it's about 7:48, so maybe we'll let you finish and then they'll come back and ask the questions and those.
Okay. Okay. Am I going too slow?
No, I don't know how much you have left. I just want to give you a time.
Once you get me talking, you know, it's a trouble.
Then we can do the Q&A in the end.
All right. Okay. So just save the questions. Are you writing them down?
It's in the chat box.
Oh, okay, good. Just medium. So I mentioned already, you know, that a lot of martial arts guys would just use petroleum jelly. I mean, it's not the best, but tea, you could just use water to make a poultice. I often, if it's hot, I like to make Juhua tea, chrysanthemum tea. Expulsion of pus, sometimes they make tea with Chinese scallions, is a traditional way to do it. Or yellow wine. Now this is a particularly Chinese wine, which I don't know which wine they're talking about. I just put it here for information purposes to soften carbuncles and expel pus. I usually use honey for that. And another traditional indication is with black vinegar if the infection is deeper. So again, this is just from a book because I've never personally used it that way, but in interest of completeness, I'll just put it in here. So typically I've used honey, fresh juice from Juhua or just Juhua tea, and then the sesame oil beeswax with Jin Huang Gao, or water if you don't have anything else. Just on a side note, like these are in the book Shaolin Formulas for the Treatment of External Injury, which was translated by, which is put out by Blue Poppy. They have a couple of formulas which I have used. I use them as a follow-up to a sort of Yunnan Baiyao powder and Jin Huang Gao powder in a flesh-eating bacteria where the person had a hole in their calf about like this that was oozing pus, and they had kind of gone through all the antibiotics and were kind of wondering what to do next. So he came into me, and I used these. So I first did Jin Huang Gao and a little bit, I think I first used actually Yunnan Biao powder in Jin Huang Gao. And then I went to this, where the external treatment is this treatment for the failure to generate new tissue in an enduring ulcerous wound. So that's a powder you sprinkle into the wound. And then I gave him this internal formula that's on the next page in the book. And pretty much within maybe 2 weeks, he had a hole like this. And then it pretty much closed up after that. So just the idea is, when you look at these formulas and the treatment, it's not much different than the idea of something like Jin Huang Gao. So this is just to encourage you, like, if you understand, let's say, my magical 10 formulas that I've made up, this number, and I really understand them well, then I can look at a book of Chinese formulas, or the Shaolin Secret Formulas book, which has hundreds of formulas, and kind of cherry pick things that I like. Oh, well, that formula makes sense because it works on the principles I'm used to working with. But okay, it's coming at it from this other direction, or it uses a combination I haven't encountered, or a combination that's super specific, that in the experience of this particular Shaolin tradition was very effective for this. So it gives you the confidence to try something like that because it makes sense according to the principles. Stage 3, bone sinew Gao. This again, Kamwo makes. The formula is also in A Tooth from the Tiger's Mouth. The thing that we did at Kamwo, and which I put here, is in the second column, Longu and Zijingpi. I'm sorry, Longu and Lujin are the replacement for tiger's bone, which was in the original formula. And so this formula is stage 3, right? It's a lot of warming herbs and things that actually start to strengthen the sinews and bones. We see Chuanwu and Sawu, which are both very hot and warming and penetrate the meridians. And we see things like Zhuduan, Duhuo, which have a bit of a strengthening quality. And we had Lujin and Longu, which strengthen the bones, in this case, as an external app. And then we have a lot of blood moving, and warming. So you can't really use this in stage 1 or 2. And this actually helps remove stasis, course the channels, and strengthen the sinews and bones. I often use it as a Zhonggu practitioner, where we put the ankle or whatever, the wrist back in place, and then we put this pulses on because it tightens the sinews up so that they hold their position. More recently, I've begun, I never used it with shoulders that dislocate easily because of how do you wrap it, but using this method with the big band-aids, you can actually get it right on the rotator cuff if there's a torn rotator cuff that's creating instability, and you can use it to help heal it and help tighten it up. So it's a really valuable formula that martial arts people use all the time. The people blow their knee out. This is going to be the 3rd stage thing if they don't elect for surgery to the tendons, or they don't need it, but there is laxity or tearing. This is the thing that's going to help them heal in the 3rd stage. I suppose you could use it on a bone break too in the 3rd stage, as long as you can get to the area. Once the heat and swelling are gone and you've coursed out a lot of the stasis, this would be the 3rd stage to actually help the bone heal faster. So with fractures, it would be a useful formula. Soaks. So soaks are this 2nd, 3rd stage thing. There are many uses of the tendon relaxing soak, and I'm pairing it with yoga stretching oil, which is a liniment, because they have a similar property a lot of times. The extra strength tendon relaxing soak that Kamwo puts together, it has like several ingredients. I listed these 4 in particular that actually help the sinews to extend when they're contracted. So that's really what we're talking about, is the ends of the muscles, the tendons and the ligaments, which contract when you sprain to protect. And so we get in this situation where in the second or third stage, we now have stiffness and inability to extend the joint. I mean, I've also treated like a lot of Brazilian jiu-jitsu guys who they get their joint locked repeatedly, right? So now to protect itself, the tendons contract and they can't straighten their arm out all the way. So aside from tween-on manipulations, we often have to have them soak in these kind of, use a soak like this that starts to lengthen out the tendons and ligaments so that they can straighten the arm again. And that in conjunction with the manipulation or acupuncture or other therapies is often the key to the treatment. It's such a key that traditionally bone setters would always have a pot of this kind of thing boiling in their clinic, so that when someone came in with a broken bone and everything's contracted, they would soak it first and then set the bone. Now, since we aren't usually setting broken bones, we don't really use it that way. And we don't use soaks for broken bones because we don't want dispersing and extending. We want to knit, right? And so we use different things for that than soaks, like the liniment I just talked about. But, you know, for years I had used this one bottle I had from a company that I don't think makes it anymore, doesn't exist, which was a stretching oil. And you would put it on to extend your muscles, right? So before you're going to stretch, you're not a flexible person, you put it on your muscles and then you do stretching exercises, or you do exercise that involve flexibility. And it helps you to keep from getting micro tears, but also helps you to extend the muscle. So when in working with Kamwo and Tom's father, who's a bit of a crazy expert on making oils, which I don't know how to make, we put together and tested this formula, which I called yoga stretching oil. But in fact, it's based on a martial arts formula. The ingenious part was adding, I think, Shenzhen Sao to it, and also using these oils like eucalyptus that are for muscle aches, and adding bingpan and camphor to make it penetrate quickly into the muscle. And I'll just say that I knew we'd arrived at the right product when I put one on my chronically tight hamstring on one leg and did stretches, and it was more flexible within 30 seconds than on my other leg. So it works that quick. And I've had a lot of people, and a lot of this is due to Tom's father, so I'm not taking the credit. We just collaborated on it. But we've had a lot of people, I've had a lot of people write me about how effective it is. Like, and I've actually had a couple people write me about using it for post-radiation treatment, where basically the tissue becomes fibrotic from the radiation, and using this liniment to help start to lengthen those fibers out and get them pliable again, which I think is really interesting because I never conceived of using it that way. So I'm sharing that with you because there's a lot of people get radiation. As long as it's in an area that's not a mucous membrane, you can put this on, like the tissue around the breast here. So I'm kind of jumping around because that's sort of what I would call second or third stage liniment. And now we'll go back to what we call a first or second stage liniment. The many uses of Diedaju, right? We tend to think of it, oh, martial arts sports guy tweaks his ankle or something, or tweaks his shoulder and he rubs it in. But in fact, this one can, Diedaju, because it's a mixture of hot and cooling herbs, this Diedaju is incredibly strong that Kamwo makes, but there are hundreds of varieties. The one we make with Kamwo is from a traditional formula that kills pain really fast by breaking stasis really fast. So tendon injuries, joint injuries, bruises, contusions, swelling, those like lumps on a bone where you crack the bone, like banging your shin into something, you actually rub it flat with this liniment. You can put it over fractures by soaking claws, or like a broken finger, you can soak cotton balls and put it on the fracture and just tape it on lightly. So in effect, you're making a poultice out of it. You can rub it into muscle pulls, and as you extend the muscle and break up that knot when they're, because what's a muscle pull is really just torn fibers that roll up. So you extend them out using the Ditta Jiao and massage together. I just said it like Cantonese style, right? Dia Da Ju in Mandarin. But so I also use it sometimes in third stage injuries. You give it to the patient to take home and just keep 3 or 4 times a day rubbing it in, because it's increasing circulation in a chronically undercirculated area. So it can be a great adjunctive treatment that way. The one, you know, if you bleed the area, you can't immediately put this on. You have to wait until the holes close, which is not long. So you could have them do it afterward, an hour after or something. And then still back to the tendon relaxing. I don't know why I flipped these slides around. I forgot to say you could also use yoga stretching oil in a post-acute muscle pull situation, or after a sprain or a fracture, like way after in the third stage, where they still have some tightness of the sinews. You could use either the tendon relaxing soak or the yoga stretching oil. With muscle pulls, I sometimes like to use the tendon relaxing soak in this later stage, because the heat, like it's like a hydroculated pack, right? It penetrates in, and then you've got this sinew relaxing effect that makes things lengthen. So typically, if you're a Twina person, you do the Twina, you put the soak on. Okay, if it's their hamstring, then you're soaking towels and putting them on. And then you go back to doing Trina and lengthen out and kind of iron out the tissues that are misaligned. So they have a lot of applicability for a lot of different things. I'm just going to share one other thing for fibrocystic breast or fibrotic tissue that I've used. It's a little messy kind of, but it works really well. And I've used it with people who had fibrotic tissue after radiation on the breast, right? That's they have fibrotic tissue here, which is inhibiting their strength of their arm movement. Is basically you take a chunk of shengdi huang, which we know is kind of gooey, right? If you poke it, and you grind up guizhi and dahuang to powder, and you push the powder into the shengdi. So first you warm the shengdi up, so it's a little bit. You don't want to bake it too much, just want to get it warm so it's even a little gooier and it's warm. You push this ground powder into it, and then you massage the area with it. So if it's after a lumpectomy for the breast, then you're going to go into the lymph areas like around the thoracic duct with the herbs and massage the tissue there. But you can also use it for fibrocystic breasts, right? So it's not cancerous, but you work it in as part of the external therapy in conjunction with the internal therapy, the herbal formula you give them for that internally. And it increases the effect because you've got a local treatment going on at the same time. So that's a kind of interesting one that I haven't, I mean, in the clinic, it may or may not be possible to do that, but you can have them do it at home very easily by ordering these things and giving them instructions on how to do it. The people who've done it say it's a bit messy, but effective. So that's my feedback on it. And then one other interesting kind of non-pre-prepared treatment. We posted this treatment on the Kamwo website as a video. You basically, this is for black eyes, right? One of the problems with black eyes, and Tom, tell me if I'm running out of time, okay? Is we put equal amounts of these herbs and we make a decoction, right? We boil it for 45 minutes in a big pot of water. I like to do about 15 to 20 grams each. Most of these herbs have an effect on the eye or the blood or move stasis. And then we take a hard-boiled egg, we peel the shell off, we wrap it in gauze so that we make like a handle, and twist the gauze so now the egg's sitting here, and then we dip it in this formula while it's hot. We let it cool a little bit, and then we massage around the orbit of the eye, and we do this for several minutes. So basically, while the egg has some properties, the egg white, it's mostly just a massage tool that fits in the orbit of your eye. And this allows you to apply these herbs to the orbit of the eye, because from a Chinese medicine perspective, while all this blood will theoretically reabsorb, if some of it does not, it will block circulation, potentially block circulation to the eye and the retina. And so, again, to me, this is a case of, oh, it's just a black eye, but maybe that black eye causes a problem 10 years later. If you treat it properly from the beginning, then they never have that problem. I just recently used this, which is why we did a video, and you can see it on the Kamwo site, where I'm actually doing it if you want to have a sense of what the treatment's like. But it's another super useful kind of wacky treatment formula for external, right? And then lastly, almost lastly, this HIT pill versus bone setter special pill, right? These are two classic formulas. Now there's the blood stasis trauma pill that's in the tooth and the tiger's mouth line, but Kamwo also in the jungle tuina line makes the traditional honey pill Diedawan, or you can make them yourselves. Again, in the tooth book, I give instructions on how to do that. So blood stasis pill is more for that first stage, right? It could be the second stage if there's residual stasis. And it's pretty much what it says. It moves stagnant blood, like a HIT pill. So we're using that as the internal therapy to go with the external therapy. The bone setter special pill is only something, it's actually a classic formula. I think its name actually means correct the bone purple gold pill, right? And it's actually referring to this color of the swelling in this second stage. So what's interesting here is it's got some blood moving, but what it's sort of saying to us is there's tonifying herbs and warming herbs, is that at this stage, you have to tonify them a bit, particularly the spleen to move the stasis, but also the blood a little bit. So we see the dongui toe, the head of the dongui root, which is tonifying as opposed to the tail, which is dispersing, or the longitudinal slice of it, which has a bit of both. And we see some baishao, which is also a tonic herb. And I really like this idea because it really shows you that it doesn't mean you have to use this formula, that second stage idea of blood stasis, fluid accumulation, but we need to start tonifying. So it really is, it's not really a third stage pill that much. It's really in that middle stage where it shines, which is pretty much where the bone setter is going to see them, in that second stage. And then the last ones I want to talk about, because over the years, I've been a big proponent of the UE oil that comes from China, which comes in that little can with a little bottle inside of it. So it looks like that, right? But over the years, they've changed the formula. And I used to use, because it dispersed cold and it had a fair amount of the oils of mugwort in it and a fair amount of the shuijie, the dragon's blood. It now has almost none of that, and they replaced it with tea tree oil. So what it's great for now is bug bites. If you're one of those people like me who gets mosquito bites and you get skin reactions, you put this on and it's almost instantaneously gone. And I don't use it for what I used to use it for. And so I again, working with Tom's father, we created this Tiger's UE oil, which is what the original UE oil was, but way, way better, because we put all real herbs in it and powerful oils that actually have this warming, blood stasis moving, and penetration effect of the oil. So it's very good for things with cold. It's started to penetrate into a second or third stage injury. And it's great for things like cupping and gua sha, where you're pulling up stasis to the surface. So you're getting a medium for gua sha because of its moving, warming effect. And you can kind of see here the standard UE oil now has tea tree and lilac oil and peppermint oil, which is why it's so great for bug bites. And a little bit of this the IEA, the mugwort. I'm pointing at the screen, which probably doesn't help you. The dragon's blood resin. Whereas the tiger's UE oil, which we're calling it, is has the eucalyptus oil, which again is sometimes used for arthritis, and then these things that actually get out wind, damp, and cold, like Changpo, Rogui, which is warming, Dingshang oil, which is warming, and then like Boha Bing, which is a little cooling, but penetrates into the body, camphor, which is warming and penetrates into the body. So, and the IEA, which is mugwort oil. So it really does the job of driving out the damp and cold and gets things out of the surface layers of the body, out of that Suli area between the skin and flesh. So that's my, just as a final slide, and then I'll take questions. So the books that really relate to this class, although mostly Tooth from the Tiger's Mouth, there's also a follow-up book, Pearl from the Dragon's Neck, which is a little more about revival techniques and using points for emergency medicine. And then I have a bunch of online learning courses with healthy seminars, which are basically courses on all the stages of injury and all the formulas you can use for all the stages, including a second course on which covers B syndrome, fractures, and I forget what the third thing is. And dead blood. So if you're interested in those courses, which sometimes we teach live, but more and more I encourage people to just go take it online. It's actually cheap, and you get CEUs for it if you're an acupuncturist. So if you're interested, if you haven't taken those courses, you want to learn all the formulas, especially going back to the first question about these advanced B syndrome or dead blood situations, I cover those in detail in those courses. So I guess it's Q&A time. So I'll take questions.
All right, so if you have a question, please raise your hand, or you can set the question in the box, and we could, I can ask the question too. Pamela, could you unmute?
Yes. Hi, me again.
Okay.
You had said that the one formula a few pages back was good for herpes zoster.
Yeah.
And
So I think that was the Jin Huang Gao, right?
yeah, Jin Wan Gao. So when people have it along the trigeminal nerve close to the eye, would it be safe to use it, or would you say no, skip
No,
it?
you can't get it in the eye, but you could put it on their
Okay.
face if you can keep it away from the eye. Yeah.
Okay, perfect.
That is a problem with that. That's why the problem with a lot of liniments, right, and poultices, we can't use them there. So it is a problem. Yeah.
All right. And then any suggestions if Vaseline is not the choice?
Well, we always traditionally use Vaseline in martial arts, and Chinese doctors often use it. And it, I've read that it actually shouldn't work because it creates a barrier to moisture, but it does work. It's just, why do they use Vaseline? Because it carries it into the body. But of course, Vaseline has its own issues. So you have to then you just use another medium. And we used to use egg whites a lot, but then you either have to have eggs in your clinic, or I used to send people out to the corner store to get them if that's feasible. Otherwise, you can just use anything. You can use water, or my teacher would often make chrysanthemum tea in those situations, which is cooling, right? So it kind of goes with the formula. And you just mix it with the water of the tea. And then I gave some examples of vinegar and these other situations which I haven't had experience with, where they're using other mediums. But the advantage of mediums is theoretically, right, the medium itself may have a property that you want to incorporate. So it's a way of modifying the formula. So, you could be creative. You could think about other mediums that maybe I didn't mention that make sense to you because they have a property you want, right? And you use it.
Thank you.
Two more. Yeah, we have two more questions. David, you want to unmute?
Excellent, thank you. Going back to your information on the tendon relaxing soak and the oil,
Yeah,
I have a patient who has ALS and his muscles are just shrinking all the time. I know that it's all about the nerves in his case,
right.
but would these be beneficial in improving quality of life in the meantime?
I think I would probably go more with the oil to massage it in the muscle because you might get more result than just putting a soak on it. And if it's in large body area, it's gonna be messy and difficult, right? But the oil is very easy to do, and you combine it with massage to bring blood flow to stimulate the nervous system. So that's what I would do. I would use like the yoga liniment, or I'd probably actually use that, yeah, because it's very safe and it'll bring the nourishment where it needs to go. The problem with the soaks, right, is one, it's nice on a wrist or an elbow. Once you start getting to big areas, you have to bring out towels and it's a bit messy and it's inefficient. So, but in theory, it would work.
Thank you very much.
You're welcome.
Okay, and then we have Michelle Wong. Do you want to unmute?
Hi. I had a question about the Jinyuan Gao. Is that something that you could use on a closed diabetic sore or sore that just isn't healing from the inside out?
It's actually perfect for that. Yeah.
Okay. All right. And then an open diabetic sore would be something.
I've actually used it.
Sorry, go ahead. Okay. Okay. How long does it take? How many applications throughout the day?
It's going to depend a little. It's not right. You're going to leave it on for 24 to 48 hours. And I would start to be safe with maybe 24 hours and see, have them report back to you that there's no allergy. Occasionally you get people with an allergic reaction. It's very unusual, but I would have them do it for 24 hours over the sore and make sure you put like a gauze that breathes. So it's not like some adhesive bandage that doesn't let air flow through.
Okay, I just muted Michelle because we had a feedback.
Yeah, I heard it.
Michelle, if you can hear me and if you want to follow up, please unmute yourself and finish your question.
Yeah, so as opposed to something like an open diabetic sore where, I had used Yunnan Bio powder in the past.
You could use it either. Or use the powder.
So you could use the Gao?
Yeah.
On an open sore?
No, on the open sore you just sprinkle.
The powder.
Like Yunnan Bio. It might be a little more effective than Yunnan Bio. And then and on the closed sore, you might actually mix it with some medium that makes it wet and make it like a Gao that actually penetrates in. So typically you could either use something that astringes if you think there's a toxic element you can withdraw out, or you can just mix it with like something like chrysanthemum tea to make it wet. It adds a little more cooling quality and you put it on. Because the advantage there is what you're worried about is that sore can go deeper, and the Gao allows this penetration down into the skin layer to get to that deep layer. And I would, like I said, I would start with, they do it for 24 hours and see how it goes. And then if that's okay, generally take a day off from it and then maybe do it again the next day, maybe this time for 48 hours. Typically I find with Gao, it's good to do a day or two on and then a day or two off and let the skin just breathe a little bit and not keep it on continuously.
Okay. I guess that's it. Well, Tom, thank you. Thank you
Thank
for
you.
everything, and
Thank
thank you
you all
everyone
for
for
coming.
attending.
Thank you all for coming. I hope the information was useful. You know, you can reach me if you have questions that come up later. You can either send them to Tom. He often sends them on to me, or you can send them to me at service@internalartsinternational.com.
Right. Okay, also please remember to check out our upcoming meetups. We have one with Shelley Goldstein for, I think, facial acupuncture. And then also Heiner Fruhoff, the creator of Classical Pearls. He also will be on to talk about foods. That will be very interesting. So lastly, if you can just leave the feedback, Meetup's going to send you a survey, just how this meetup went. So if you can just leave a positive feedback or whatever feedback, that'd be great. All right. Anyway, thank you, everyone.
All right. Thanks, Tom. Thanks, everybody, for coming.
Okay. All right. Take care, everyone.
All right. Bye.